Hello, my name is Nat Josephine, and in this presentation, I begin about recent changes and their impact on the roles and responsibilities of the midwife. Follow the impact of the midwife in meeting the physical, social, and psychological needs of a woman and a family. We'll also discuss of the role of the nursing and midwifery council performs, and I continue analyze the implication of the code of midwifery practice on and the role of a midwife. Along to explain the need for effective communication in a multidisciplinary healthcare setting. At the end, to evaluate the effectiveness of the multidisciplinary approach in the healthcare setting, including the positive, limitation, and effectiveness of this approach within the role of the midwife. So, um, Alright, so a discussion of the recent changes and the impact of the roles and responsibility of the midwife. There have been significant changes in healthcare systems and improvements. So we are going to see a few changes and the impact in the recent year, such as personalized care, continuity of care, self-care, postnatal, perinatal mental health care, multi-professional working across boundaries, a fair and adequate payment system. So, there have been a growing recognition of the importance of person-centered care and the promotion of normal psychological birth by providing a good quality care to the mother's baby and their family. Every woman should build a good relationship with a midwife and other health professionals to create a care plan concerning their needs, care, and about the progress of the pregnancy. All women should have free from all prejudice information to aid their making and progress of a care plan. All this should be done by using digital maternity tool in which shows and access their health record. Continuity of care. Every midwife provides self-care based on the trust and respect concerning the woman's wishes. Each and every woman have a midwife which is part of a community of 4 to 6, all based on midwives very close to the person and the family continue to provide throughout the pregnancy, birth and postpartum stages. As every midwife should build a good relationship and working together with other professional teams such as obstetric, neonatal, and other agencies to ensure the patient receives satisfied care as requires and that it is getting together with the community care. In addition, some midwives may now have the authority to prescribe medication, order diagnostic tests, and provide excellent services to their patient. Nowadays, midwives are more work in a team with other professional healthcare, should be given correct information to other team and able to communicate effectively. And also about the level for maternity services is to monitor information concerning quality in the maternity services has been provided properly, should be improve the quality and outcomes of the services to foster a culture of learning and continuous improvement. Rapid referral process between medical professionals as part of the MDT. They have been a massive investment into the community services. This has been enable women to see their midwife and obstetrician as much as needed after had a baby is to improve their mental health. Midwife is there as someone who can give support and help the mother socially as well as the physical and psychological needs with the baby. All medical professional workers together should also train together to be enable well understanding their respective roles and expertise that other professionals able to provide. MDT communicating has been improved by using electronic maternity record easy to share between experts and organizations. Midwives now have access to advanced tools and equipment for fetal monitoring. Ultrasound imaging electronic health record have improved the accuracy of assessment and the ability to monitor and manage any complications, however, ensuring safer outcomes for mother and the babies. All the professionals are able to communicate effectively. The midwife need to provide choice and access to a special care when needed immediately. Is to support services or referring to a specific specialist treatment depending on the requirement. This allows women to customize the care they received. Every midwife should be paid in a fair way which satisfies them for the fact that they are high quality and provide high quality services. It should consider by different structures such as cost, different services, ensuring collaborations. Deliver high quality care to the woman, guarantee sufficient money for follows the woman and a baby as possible. Recent changes in the healthcare have expanded the roles and the responsibility of midwives. They are now more autonomous, working without a professional team, focus on health promotion and education, receiving fair payment, advanced technology. Midwives are all good trained to meet the needs of a childbearing families and improvement maternal and neonatal outcomes. So, sorry, yeah, midwives' impact are very important and can have a positive side effect on the well-being of both the mother and the family. Although there are some structures in which midwife contribute to meet these needs, like physical needs, social needs, psychological needs. It's when a midwife continues to monitor the mother's and the baby physical health, including their sleeping routine, appetite, diet, and energy levels. All midwives are trained to be able to provide physical care and support to all women during their pregnancy, labor, birth, and the postpartum stages. However, they should check out the mother organs such as uterus, lochia, perineum, and breast to make sure the mother's body is recovering physically after giving birth. Midwife has to recognize any complications such as infections or difficulty with urination or bowel function and giving appropriate treatment with immediately effects. Midwives offering breastfeeding support, monitoring the baby's growth, checking on the mother's physically recovery, and providing appropriate care on the newborn baby. Midwives, sorry, yeah, midwives are being placed to anticipate and recognize any changes may lead into complication and additional needs. It could be physical, social, psychological, spiritual, cultural, loss, or end of life. So, in any situation, the midwife is responsible for recognizing them for media response management and escalation. During the pregnancy and after childbirth can be very emotional and psychologically challenging for the woman and her family. So the midwife will provide emotional and psychological support throughout the season. They give reassurance, guidance, and counseling of any emotional aspect such as frightening, mood changes, depression, and anxiety. Once noticed and identify mental health issues on the woman, midwife refer her to appropriate professional when needed. They also contribute to overall well-being and mental health of a woman and a family. Midwives continue providing care and establish a good relationship based on approach have an important impact on the meeting these physical social, and psychological needs. There should be a good relationship to the woman and the family to provide care within earlier pregnancy throughout the postpartum season. So midwife immediately recognize any mood changes such as depression, anxiety, and address this concern with immediately effect. Mhm. So um, the NMC, known as Nursing and Midwifery Counseling, is to provide good and professional skills, knowledge, respect, and taking care of all women, patients, newborn babies, and their families. All midwives work across the sequences from pre-pregnancy, during pregnancy, labor and birth, postpartum, and early days or week of a newborn baby life. All nurses and midwives should be registered in the NMC and trained to be enabled while understanding their respective roles and expertise that other professionals are able to provide. They work independent professional in the UK. So all midwives work in hospital, midwife-led units in the home, clinics, obstetric consultant-led clinics. All midwives respect all mothers to be able to take a good care of the newborn infant. Their priority is to make sure that their dignity is preserved and their needs are recognized and responded to know as patient-centered care. Ensuring the care always focuses on the needs and clinical decision and providing care that is respectful for and response for them. Midwife have to achieve a good communication skills to be able to communicate with the patient's needs and give enough support. As part of the NHS 5 years forward review, they sponsored by Maternity Review in February 2017 named Better Birth. The Better Birth identifies 7 essential progress. So the main duties of NMC, all midwives practicing in the UK must be registered with the NMC, ensuring all nurses and midwives are all registered and eligible to practice within in the UK, ensuring all review for the education and training conduct and performing of midwives. Deep deep investigation or allegation of impaired fitness to be able to practice their role. It helps to ensure the midwife maintain high standard in their work with women and their family, providing safe response, compassion care in appropriate environment. Also to ensure safety to the public. Midwifery is a critical healthcare profession that provides care and support to the woman during pregnancy, childbirth, and the postpartum period. The role of a midwife extends beyond clinical skills, including emotional support, education, responding care, according by the mother needs. They are obliged to uphold this standard, and if they fail to comply, the NMC can reprove them and even in a serious case remove them from the register onwards. The code have an important impact on the quality of the care provided by midwives and all over experience achieved of a woman during childbirth. This analysis discover the implication of the code of midwife practice and involving the role of the midwife in healthcare settings. Midwives are fully responsible for the action in their workplace due of lack of staffing or resourcing the care can decrease. The code states that midwives must put the interests of people using or needing midwife services first, must provide care ensuring safety of women and their family, and also must make sure that those receiving high standard care are treated with respect and to avoid discomfort behaviors. Treat people as individual and dignity, listen to people and respond to their needs. Make sure that people with physical, social, and psychological receive appropriate treatment. Alright, so multidisciplinary team known as MDT have created a successful system in which is to organize and coordinate healthcare services, meaning different professionals collaborating and communicating effectively. This team contains doctors, nurses, occupational therapists, and other health professionals to all work together, communicating, plan together, sharing information concerning the health issue of the patient. Communicating has been improved by using electronic system in which records easy to share between expert and organization. To ensure all the patient is receiving the best care, in this role, midwife will spend the majority of the time with the patient so that able to provide an appropriate support and care. MDT work together should also train together, enable well understanding their respective role and expertise that other professionals able to provide. It greatly reduces the risk of any errors or shortfall in patient safety. As a midwife has to achieve a good communication and build a good relationship between the mother and the family to be able to communicate with their needs and give appropriate support, improve understanding from both sides, also increase the patient satisfaction and moreover high level of the care quality. As mentioned earlier, midwives play as an important role in the multidisciplinary team approach in healthcare setting. They have to make sure are able to communicate efficiently, share their skills and experience achieved. These include shared decision making, informed choices, goals, and ensuring safety to everyone by improving outcomes, better access to health information and resources, satisfaction from patient, care plan, and also involving learning opportunities, providing such as incorrect information sharing, misunderstanding of responsibilities are completed in goals. So, in conclusion, over decades, the midwife profession has been involved and will continue as time goes on. Indeed, medicine has been progressed, so have the roles and the responsibility of the midwife, registered nurse, midwife. Midwives are adapting and improving their skills and competencies to maintain a maximum high standard of care and support for the mother and the baby. Between 2022 and 2023, there are approximately 788,638 registered nurses midwife and nursing associate in the United Kingdom. Number has grown a lot. So, thank you for listening to my presentation. Thank you.